Hi everyone, welcome to our channel Canadian Nurse Expert. Today's topic is PTSD or post-traumatic stress disorder. Trauma lingers for a long time. It is not just about memories. Trauma can change how we feel and act. It changes how we see the world. Sometimes the effects of trauma linger long after the event. This can be post-traumatic stress disorder or PTSD. PTSD is a serious condition. It needs proper care and treatment. We need to understand PTSD. We need to know how to spot it, and we need to know how to get help. This is about understanding trauma. This is about healing. We all experience stress. It's a normal part of life. But PTSD is different. It's not just feeling stressed or upset. PTSD is a mental health condition. It's triggered by a terrifying event. This event may be something you experienced firsthand, or it could be something you witnessed. With PTSD, the body stays on high alert. It's like your internal alarm system is stuck. This fight or flight response is meant to protect you. But with PTSD, it's triggered even when you're safe. This can make everyday life feel overwhelming. PTSD is not a sign of weakness. It's a real medical condition, and it's treatable. PTSD shows up in different ways, but there are some common signs. These are called the hallmarks of PTSD. One hallmark is re-experiencing the trauma. You might have nightmares, you might get flashbacks. These feel like you're reliving the event. Another hallmark is avoidance. You might try to avoid anything that reminds you of the trauma. This could be certain places, people, or activities. Then there's numbing. This is feeling emotionally detached. It's like you're just going through the motions. You might have trouble feeling joy or love. Finally, there's hyperarousal. This is being on edge all the time. You might be easily startled. You might have trouble sleeping. You might be irritable or angry. These are just some of the ways PTSD can manifest. Everyone experiences PTSD differently. PTSD doesn't always show up right away. Symptoms can develop weeks, months, or even years after a traumatic event. This delayed reaction can be confusing. You might not connect your symptoms to the trauma. You might think, why am I feeling this way now? The truth is, trauma affects everyone differently. There's no set timeline for when PTSD will appear, and once symptoms start, they can come and go over time. Some days might be better than others. There might be periods of relative calm, but then a trigger can bring back all the feelings. This can make it hard to feel like you're in control. The good news is, with the right help, you can manage these symptoms. Vulnerability to PTSD. Who is most at risk? Anyone can develop PTSD after a traumatic event, but some people are, more vulnerable than others. This vulnerability depends on several factors. Some are related to the trauma itself. For example, the severity and duration of the trauma play a role. So does the level of threat you felt. Other factors relate to your personal history. Did you have a supportive childhood? Have you experienced trauma before? This can increase your risk. Genetics also play a role. Some people are genetically predisposed to developing PTSD. And finally, your social support system matters. Having strong social support can make you less vulnerable. It's important to remember that vulnerability is not destiny. Even if you're at higher risk, it doesn't mean you'll automatically develop PTSD. Recognizing the red flags. Key symptoms of PTSD. Knowing the signs of PTSD is crucial. Early recognition can make a big difference in getting the right help. One key symptom is intrusive thoughts. These are unwanted memories, images, or nightmares related to the trauma. They can pop up out of nowhere and be very distressing. Another red flag is emotional numbness. This is feeling detached from your emotions, like you're just going through the motions. You might have trouble feeling joy, sadness, or love. Avoidance is another common symptom. You might avoid places, people, or activities that remind you of the trauma. This can lead to social isolation and make it difficult to engage in daily life. Hypervigilance is also a telltale sign. This is being constantly on edge, like you're always expecting danger. You might be easily startled, have trouble sleeping, or feel irritable and on edge. If you notice these symptoms, don't ignore them. Reach out for help. Pathways to healing: effective treatments for PTSD. The good news is PTSD is treatable. Several effective therapies can help you manage symptoms and regain control of your life. One of the most effective treatments is cognitive behavioral therapy, or CBT. CBT focuses on identifying and changing negative thought patterns and behaviors related to the trauma. It helps you understand how your thoughts, feelings, and behaviors are interconnected. Another powerful therapy is eye movement desensitization and reprocessing, or EMDR. EMDR uses specific eye movements or other bilateral stimulation to process traumatic memories. This helps to reduce the emotional intensity of the memories. Medications like selective serotonin reuptake inhibitors, or SSRIs, can also be helpful. SSRIs are antidepressants that can alleviate symptoms like anxiety, depression, and nightmares often associated with PTSD. The most important thing is to find a treatment plan that works for you. Talk to a mental health professional to explore your options and find the best path to healing. Beyond therapy, complementary strategies for recovery. While therapy is crucial for PTSD recovery, there are additional strategies that can support your healing journey. Mindfulness practices like meditation and yoga can be incredibly beneficial. They help calm your nervous system, reduce anxiety, and improve your ability to cope with stress. These practices focus on being present in the moment, which can be helpful in managing intrusive thoughts and flashbacks. Connecting with others who understand what you're going through is invaluable. Support groups provide a safe and supportive space to share your story, learn coping mechanisms, and realize you're not alone. Engaging in activities you enjoy is also essential. Hobbies, exercise, spending time in nature. These can all boost your mood, reduce stress, and help you reconnect with yourself. Remember, recovery is not just about managing symptoms, it's also about rediscovering joy and rebuilding your life. A beacon of hope. Recovery is possible. Living with PTSD can be incredibly challenging, but it's essential to remember that healing is possible. You don't have to suffer in silence. With the right support and treatment, you can overcome the challenges of PTSD and live a full and meaningful life. The journey to recovery might be long and sometimes difficult, but every step you take towards healing is a victory. Remember to celebrate your progress, no matter how small it may seem. Reach out to a mental health professional, connect with a support group, and embrace self-care practices. There is hope, and you are not alone.